Niazi. Today, the topic of presentation is Fluoxetines, presented by the historians. These are my group members. So, first of all, it's come introductions. So, what is Fluoxetines? It is an antidepressant drugs, belongs to the group of the medicines known as selective serotonin reuptake inhibitor, which are also called SSRIs, and it works by increasing the activity of the serotonin in the brain. So FDA approved the fluoxetine in 1987 as a antidepressant drugs. So then come its discovery and the history. It traced back to the 1917s, developed by the E. Lilly and the company. The development of the fluoxetines faced several challenges regarding its safeties, and then FDA approved fluoxetine as an antidepressant in 1987. So, as I earlier told that it is a selective serotonin reuptake inhibitors. So the question comes in mind: what is serotonin and what does serotonin do? So serotonin is also known as 5-hydroxytryptamine, is a monoamine neurotransmitter and also act as a hormones. It is made from the essential amino acids tryptophan 90% found in the jelly lining while 10% inside your brain. Then serotonin in your brain regulate your mood called feel good and the chemical of the body at a normal level. You feel more focused, emotionally stable, happier, calmer, while at a low level it can cause depressions. So what does serotonin do in blood clotting? It helps the body to heal faster in bone health. It can cause the osteoporosis when the levels are too high in a sleep. It can stimulate the areas of brains that are in control of sleep-wake behavior. And in a mood regulations, it reduces the feeling of the depression and anxiety. And in sexual functions, it can cause a decreased libido when the levels are too high. And in a nausea, it helps the body expel food quicker than the normal. Then come its mode of actions. Selective serotonin reuptake inhibitors increase the concentration of the serotonin in the brain, and serotonin regulate the mood, emotions, and anxiety. It is reabsorbed back into the cell from which was released called reuptake regulated by the proteins called serotonin transporters. Fluoxetine work by inhibiting the reuptake of the serotonin, increasing level of serotonin available in the synaptic cleft. Please look at this diagram. This is the post presynaptic cell and this is the postsynaptic cells. The between the presynaptic and the postsynaptic is called synapse. Through the presynaptic cells, the serotonin released into the synapse, and through the synapse, it can goes into the postsynaptic cells through the serotonin receptors and can cause euphoric conditions. But the main function of SRI, but after performing the functions, it can goes back to the presynaptic cells. So the main function of the SSRI is to block these channels. So it blocks the reuptake of the serotonin back into the presynaptic cells. So there is a more molecule of this the serotonin in the synaptic cleft, and there is more chances of serotonin molecule to bind through the postsynaptic cells, and which can cause euphoric conditions. Then come its pharmacokinetics. Fluoxetine is administered orally. Absorption is relatively slow and variable. Oral bioavailability of the approximately 60% and after first pass metabolism in the liver. High volume of the distributions and the bind extensively to the plasma proteins, primarily albumin, with the approximately 94 to 95% of the drug bound. And it rarely crosses the blood-brain barrier as well. Fluoxetine undergoes the extensive hepatic metabolism and can get converted to the norfloxacin, which is active metabolites, by the cytochrome P450. And norfloxacin has a longer half-life than the fluoxetines, and the elimination half-life is approximately 1 to 3 days and 7 to 9 days for the norfloxetines. Due to the long half-life, it lasts for several weeks and allow once a daily dose. Then come its pharmacokinetics. Fluoxetine is a selective serotonin reuptake inhibitor, and as fluoxetine work increase the serotonin level in the synaptic cleft. It increases the concentration of the serotonin that binds to the postsynaptic serotonin receptors, leading to the enhanced serotonergic neurotransmissions. Fluoxetines primarily target the serotonin transporters proteins responsible for the reuptake of the serotonin The increased level of the serotonin in the synaptic cleft ultimately result in the adaptive change in the various brain's regions and the neural circuits. Then come its drug-drug interactions. It can interact with the drugs including the antiplatelets drugs such as clopidogrel, NSAID, and the blood thinner. Taking MO inhibitors with these medications may cause fatal drug interactions. The risk of the serotonin syndrome toxicity increase if you are also taking the other drugs that increase the serotonin, e.g., SSRIs and SNRIs. So in this case, you can tell your doctor or the pharmacist if you are taking the other product that can cause a ravenous antihistamines, muscle relaxants, and opioid pain relievers. Then comes its clinical uses. It is used in the major depressive disorder, and it also used in the obsessive compulsive disorder as well. It is also used in the panic disorder and in premenstrual dysphoric disorder. It also used in generalized anxiety disorder as well. So then come its interesting facts. It's gained popularity by becoming the widely prescribed antidepressant in many countries, has a long half-life as compared to the other SRIs, and fluoxetine has been approved for the treatment of the depression in the children. It's a less frequent dosing. It also treats the OCD and the bulimia nervosa in the children as well. Then come its side effect. Fluoxetine can cause side effects such as nausea, diarrhea, headache, insomnia, which is difficulty in the sleeping, the drowsiness, and the anxiety or the nervousness, restlessness, dry mouth, sweating, rash, itching, swelling, and it also can cause the suicidal thoughts or the behavior, which is a serious effect. So then come its dose recommendation. In major depression, it is about 10 to 20 mg orally once a day. And in obsessive compulsive disorder, it is 20 to 60 mg day for adult. In panic disorder, it is 20 to 60 mg orally per day. And in a premenstrual dysphoric disorder, it is 20 to 60 mg per day. Then come its contraindications. Contraindication to the people who are hypersensitive to the fluoxetines. Patient having a hepatic or the renal insufficiency, a history of the heart disease as well. Recently had a heart attack and in a liver disease. It can cause contraindication as well. So then come its brands. Fluoxetine is widely prescribed as an antidepressant drugs in Pakistan. Here is some brands. Its most famous brand is Prozac, and other brands are Deprecab, Floxil, U4, Fludac, Flox, Prozac, and Seromax, and Prozazine as well. That's all from my side. I hope you